Hello, I'm Dr. Mark Kimpton, and today we're going to be talking about the Semester 2 Clinical Skills course. Welcome to orientation. First off, let me just say thank you for being here and congratulations for completing your first semester. So welcome into the second semester of Ross University School of Medicine. So first, we're going to lay out our course objectives. Today's objectives are going to be to discuss the two-track curriculum, to discuss the module overviews, to discuss briefly the CS course content and activities, to talk a bit about assessment, grading, attendance, dress codes, your assigned text, and your schedules. So let's start by just, again, I want to congratulate you for getting through the first semester. And so now we'll talk about two different tracks that you can take from this point forward. And the difficult part of this is making an honest self-assessment for where you are as a student. If at this point you were just able to get through the first semester, but you're having a difficult time retaining the information you just learned, you might want to give serious consideration to taking the curriculum track. This is opposed to the accelerated track. And so the two tracks are the same material, just at a different speed. The accelerated track compresses all of the material into 4 semesters. The curriculum track spreads out the next 3 semesters into 4 semesters. So you've already completed the first semester, but the next 3 semesters worth of material can either be taken in 3 semesters, which is the accelerated curriculum, or going to be taken into 4 semesters, which is the curriculum track. And that's actually going to be 5 semesters in total for these first two years of medical school. So we're going to look at those in some details. And so the 2 cores of the material you're going to be given throughout this semester are part 1 would be the Foundations of Medicine, and part 2 would be the Clinical Skills course. Both of these are going to be making up this next semester for you. For the basic modules, the organ systems are going to be broken into cardiovascular system, respiratory system, digestive system, neuroscience and psychiatry, and the endocrine system. Regardless of which track you take, you'll be taking all of those modules. If you're taking the accelerated track, you will add to those modules the renal module and the reproductive module. If you're on the curriculum track, the renal module and the reproductive module will be next semester, not this semester. So if you're following along on the PowerPoint, you will see a slide that shows the difference between the Foundations of Medicine and the CS courses and how they line up in these different tracks depending on where you're taking these. So you can see that the accelerated track continues introducing new material throughout the semester, while the curriculum track has some study breaks built in where the reproductive and the renal modules are inserted. So let's talk about the clinical skills curriculum for semester 2. And the overarching theme is, how do doctors think? And that's the core concept behind having the clinical skills curriculum. So we do this by various means, teaching interview skills, teaching physical exam skills, and getting you to start thinking principles such as illness scripts and how physicians think. So we'll be walking through these different components as we go through this orientation. So CS activities will include physical exam skill labs, medical simulation, service learning opportunities, as well as a course that we call SGL-IST, which stands for Small Group Learning or Individual Skills Training. And we'll talk about these in some details. So the PE skills. And first off, you're going to need to know what equipment you need to bring to each individual lab. Each of the labs may have different equipment you need to bring in depending on which lab you're doing. And so a good habit to get into is to read the course documents before you attend any of your PE skills labs, and these are going to be posted on Canvas. There are videos that go along with the PE skills labs, as well as handouts that you need to read. I would highly recommend that you watch the video before you go to the lab and make sure you read the course documents as to what equipment you need to bring, as well as what the professional dress code is for that session. Any session that has a standardized patient, the dress code will be professional dress. If there is not a standardized patient present, then blue scrubs are adequate. So for your cardiovascular skills, you'll need to bring a stethoscope. And there's also other equipment that you can bring for other labs, such as diagnostic tool sets for your otoscope and ophthalmoscopes, as well as miscellaneous tools, such as tuning forks. And you need to have a 128 hertz tuning fork at the least, as well as reflex hammers, blood pressure cuffs, cotton balls, and wooden cotton-tipped applicators, a pen light, and a pocket Snellen chart for visual acuity testing. So during the CS activities, especially the PE skills labs, it's important that you preview the material. Taking a few minutes to preview the material is going to save you a lot of complications and headaches on the back end. So those videos and documents are posted on Canvas. I highly recommend that you review those prior to coming into the labs, so that the labs are going to be the most valuable time that you can utilize it for. In particular, if you've got questions after watching the video, then you can ask that during the lab time. If you come into the lab time cold and you run into questions that you could have previewed that material beforehand, it's going to make that a lot more valuable for you. Also, be aware there are test questions that are going to be on your minis as well as the final that come out of both the videos as well as the handouts. The videos are intended to show you what you need to do on the PE skills. The handouts are intended to tell you why you're doing what you're doing. They're answering two separate questions. So the video is demonstrating what you need to do for the PE skill. The handout is giving you the context behind the material, how to integrate this into your anatomy and physiology, why you're seeing things clinically. So they're answering different questions. So both of those sources of materials are testable on your minis and final. So the PE skills labs, your preceptors for the PE skills labs will grade you based upon your preparation, your professionalism, punctuality, your dress, and participation in the session. So if you come into the session and do not add anything to the session and you're not prepared, that is going to directly affect your grade. Now, if you do have a grade that you have questions on, feel free to contact whoever the facilitator was for your PE skills lab. So make sure you know who the facilitator is for each of your lab sessions. Get their name so that if you do have questions about your grade, you can send them an email and ask that later. For the cardiovascular skills lab, check your schedule, view the video prior to coming into the session, bring your stethoscope, and be in a professional dress. There will be a standardized patient present. So professional dress for men, this requires a tie, that you are professionally clean, that you have your white coat. For women, it's a modest dress. Again, modest is a word that can be open to interpretation. If you struggle with what should be modest and what shouldn't be, err on the side of caution. In particular, be aware you're going to be bending over, you're going to be leaning, kneeling, squatting. So if there's anything that might be revealing when you're doing any of these maneuvers, consider some other dress code that is going to leave you modest when you're doing these maneuvers. Another thing to consider is hair. If you have long hair, male or female, if your hair falls into your patient when you're leaning over the patient, it needs to be tied back so that you're not contaminating your hair and you're not contaminating your patient. So be aware of these things before these skills. For the respiratory lab, again, check your schedule, view the video, bring your stethoscope, and wear professional dress. Again, this is another session that will have a professional patient. For the abdominal 2 lab, very similar. Check your schedule, view the video, bring your stethoscope, and have professional dress. There will be a professional patient present. For the Neuro 1, Neuro 2, and Neuro 3 labs, there will not be a professional patient. You will be testing these exams on your fellow colleagues, so you can come in with blue scrubs and a white coat if you would prefer, or you can come in with professional dress. Either one is an option. For all of the neuro labs, the equipment that you'll be required to bring in will be different, so make sure you have the right equipment for each of these labs. For the chronic disease lab, bring all of your equipment. You will not know exactly what test you will be required to perform for either the chronic disease lab or for the final. So we want you to be prepared for any exam that you might run into. So bring all of your equipment. There will be a professional patient, so come in with professional dress. And let me just take this opportunity to remind you that these are PE skills labs that you're being introduced to, but we don't expect that you're going to have a command of these skills when you come in for just this one visit. This is simply a foretaste, and we expect that you're going to take this skill and then practice this skill. Any skill requires practice to have a mastery. So don't think that you're going to be able to watch the video once, come into the PE skills and demonstrate it once, and then have a command of these skills. The more you practice these skills, the better your efficiency is going to be. And by the time you come around to your final exam, you don't want to be cramming the week before your final trying to learn all these skills. Skills must be practiced over time. So other CS activities that you'll be participating in this semester, you'll also be doing the Harvey Heart Sounds Lab. This is a simulation that's graded on attendance, participation, and professionalism. Anything that has a standardized patient or a professional patient, if you show up late for those sessions, you will be required to leave the session. You will not be allowed to enter the session. You'll be given a 0 for that session, and you'll be required to speak with the course director. So be sure you're on time. Get into the habit of checking your schedule every day, because each semester there are changes that are made. So get into the habit of checking your schedule every day to make sure that the time and the place has not changed. And then another CS activity is SGL-IST. This is also a mandatory session. There will be a standardized patient with each of these sessions. SGL is an 8-case course where you're given an opportunity to do an interview, and so there's typically 8 students per session. So one of those 8 students will be doing an interview. You'll do an interview for roughly 30 minutes. Throughout the case, you'll have the opportunity to walk through your process elements of the interview, all the details of what you should be obtaining from your interview, and practicing your interview skills. After that, each of the students in the session will be given a chance to ask questions that may not have been done by the individual that was doing the interview. And then after that, as a class, you'll be given a chance to walk through what you think a differential diagnosis would be. If there's any knowledge gaps, opportunities maybe do the research afterwards to look up those details. And also what laboratory investigations you might want to consider to investigate your differentials and your hypotheses. So this is a session that starts to begin formulating, how do doctors think? What's the process look like when you're seeing a patient, walking through the interview, considering your diagnoses, and how would you investigate those diagnoses? So further details for the SGL-IST, these are mandatory. If you show up after the standardized patient shows up for these sessions, you will not be allowed in that session. You'll be given a 0 for that assignment. And be aware, if you have an assignment that you obtain a 0 for that session that has a standardized patient, you can also lose up to 25% of your CS grade for the entire semester. I want to reemphasize this because we take this as an issue of professionalism. If you show up late to see a standardized patient, that is an issue of professionalism that can cost you your entire semester. If you lose those points, that's 25% off of your entire CS grade. That puts you at risk for failing the entire semester. Now, there are opportunities to remediate that grade to a degree, but the long and the short of this is do not show up late for your classes that have a mandatory patient and mandatory attendance. Now, there are always going to be situations where you might not be able to control what happens and why you cannot show up late or why you can't show up for an assignment. There are only 2 issues which are going to obtain an excused absence. One is for health reasons. If you are sick enough to where you cannot attend class, you must seek medical attention. You need to bring in a doctor's note, and that needs to be done within 24 hours of the assignment that you've missed. So you need to send that to your facilitator as well as send a copy of that to the course director, which is me. So I'll ask you to send that to my email. It's markkimpton@rossu.edu. Make sure you have that done within 24 hours of your missed assignment. The other opportunity for an excused absence is to have this cleared through student affairs. And these are things that need to be done prior to you missing class. You cannot do this after class. You have to have your excused absences through student affairs done prior to the assignment that you miss. Those are the only two ways that you can obtain an excused absence. Even as the course director, I cannot grant you an excuse for a missed assignment. The only place those can be excused is through either a health note or through student affairs. So let's finish up CS activities by also talking about service learning opportunities. These are opportunities that will be detailed, and they start off in your semester 2. They include the possibility of a reflective project or also on a service experience. There's material on Canvas that will outline what the details of your service learning will look like. Be aware you need to complete a service learning project before you matriculate from your final semester in the first 2 years of medical school. So if you're on the 4X track, you need to complete a service learning project before the end of your 4X semester. If you're in the 5-semester track, you'll need to complete a service learning project before you finish that 5th semester. To be considered for completion, it has to be before week 9 of your last semester. You have to show attendance to the activity, either submission of a reflective project or a passing review of a reflective project. And upon completion, you will receive 5%. It's a bonus to your grade for whatever semester you complete that learning project. So if you decide to do your service learning project in the 2nd semester, you'll receive a 5% bonus to your CS grade for that semester. If you want to wait till your 3rd semester or 4th semester or possibly 5th semester, whatever semester you complete that service learning project, those points are added to that semester. And again, there are details to the service learning. There's a manual that's been created, and that's now on Canvas so that you can review that. So assessment. How are your grades for the semester obtained for the CS semester? You will obtain a letter grade. A failing CS course equals failing the semester. So you can pass the foundations of medicine, but if you do not pass the CS component of the semester, you will need to repeat the entire semester to include the foundations of medicine. So while there are 2 separate components to the semester, both of those components must be passed in order for you to pass the semester. Failing either one of those will require you to repeat the entire semester. The way that your CS grade is obtained, 70% of your grade is through your simulation grades and your PE skills and SGL IST grades. So all of your activity grades, simulation, PE skills, and SGL, combine to create 70% of your grade. 30% of your CS grade is made up by your CS final. So you can obtain a 100% by attending and have participation to all of your activities even before you walk into the final exam. Now, assessment, we detail our expectations for every activity in the documents that are posted on Canvas. You will know exactly what's expected of you for every one of your assignments. Again, read those assignments before you go to class. We offer verbal feedback during each of these sessions. During and after sessions, as needed, your facilitators will guide you to help you to show areas of improvement. And you're also given written feedback in your SGL courses. So when you write your history and physical papers, you'll be given a grade that helps to give you an assessment on how closely were you able to obtain the material that you were supposed to in your history. There's also test questions that come from the CS component. So there's a slide in the PowerPoint that will give you a breakdown of exactly how many questions come out of the CS material. For the entire semester, it's up to 22. And then let's talk about your practical exam. At the end of the semester, you will have a practical exam. The practical exam is an all or nothing test. If you fail the practical, while you'll be given a numeric number, if that number is a failing number, you will get a 0 for the CS as a total. So 30% of your semester grade is made up of your final exam. If you fail the final exam, you get a 0 for that grade. Now, if you get any number over the passing number, then you'll get that numeric number, and that averages out for your letter grade for the semester for your CS component. Failing the practical exam will place you at failing the entire CS course. And again, if you fail the CS course, you will fail the semester entirely. You'll need to repeat the entire semester. The way the CS exam is graded, you will have 3 sessions. You'll have 3 stations. You need to get a minimum of a 60% in all 3 stations to pass the CS exam. You need a combined score of 70% or greater in all 3 sessions in order to pass the final. So you can get a 65 in one station. As long as your overall exam grade is 70% or greater, you will pass the exam. You can have a total exam score of over 70, but if you fail one session less than 60, that is still a failing grade for the CS exam. So you have to have a minimum score of 60 in all 3 stations and a total overall score that averages 70% or greater to pass the CS final. Expectations for the final exam. The practical exam is going to be listed on Canvas. The details to what will be expected on the exam are in print. There will not be any surprises on the final exam. There are exam review sessions that are offered throughout the semester, and including towards the end of the semester, there is extended hours that the junior teaching faculty make themselves available that you can come in and practice your exam skills. This is a skill. You need to be practicing throughout the semester. If you try to cram towards the end, that is not going to give you a mastery of the skill. Then you come into the final with more anxiety than you should. That anxiety makes it even more difficult to remember what you're supposed to remember, and those are the students that are struggling. Practice these skills throughout the semester. Also be aware you're going to be tested on physical exam skills that you were given a semester ago. All the PE skills you were introduced to in semester 1 are testable in semester 2. So if you've not been practicing those skills, start now. Get into the habit of practicing your PE skills. A couple minutes on the weekends should be adequate if you're doing it consistently, so that by the time you come around to the PE skills final, you have a mastery of these skills. Again, the practical exam grade, if you fail the CS exam, you get a 0 for those results. Now be aware, all failing grades are automatically reviewed by the senior faculty. We review every failing CS final. So you cannot grieve those grades. Those grades have already been reviewed by senior faculty. Now, if you did receive a grade on your CS final that you thought was not correct, you always have the opportunity to grieve your grades if you think it was graded unfairly. But do this with some caution. I've sat on these panels now for a couple of years, and in most cases, the final grade after the grieving process is lower than the grade that was initially given. If you grieve your grade, be sure you have a sound and valid reason to grieve that grade. Whatever grade you get after the grieving process, that is your final grade. And statistically, I would say 80% of the grades that are grieved get a lower grade after the grieving process. 4 out of 5 times, a student who grieves their grade gets a lower grade. It is a rare situation that the student knew more than the facilitator who is doing their grading, and they actually get a higher grade. And usually those grades are only insignificantly raised. And these are students that passed. Because remember, all the failing grades are automatically reviewed by the senior faculty to make sure that there wasn't a bias or a harsh grade that was inappropriate. So these are only grades that have already passed. The vast majority of those go down after the grieving process. So it's there, it's available to you. Don't feel that you don't have a recourse if you think something was really done unfairly. And we are human. Sometimes mistakes are made. Sometimes students catch things that we don't. I'm not saying that doesn't happen, but it is rare. Be very careful when you do this. So practical exam success. The key is deliberate practice of skills. The only way to learn a musical instrument is by practice, practice, practice. The only way you're going to be a good physician using your physical exam skills is practicing these skills. You have several hundred students around you that are in the same situation you are. They need to listen to as many hearts as they can. They need to take a listen to as many lungs as they can. And the more normal hearts and normal lungs and normal abdominal exams that you see and do, the more confident your skill becomes and the more you'll understand variations of normal. If you're only doing this a couple of weeks right before the final, you don't have a mastery of those skills. So practice these skills. All of the materials are going to be posted on Canvas. There will be review sessions that you can have available time, even extended hours before the finals. There will be multiple support tools and documents for self-guided study. There are videos and narrated PowerPoints on Canvas. And be aware there will not be any electronic devices allowed during the CS final. So have these things in mind. Students do fail the final. Don't let this be you. Grading. Grading for all activities is based on careful constructed rubrics. Faculty receive training and review prior to the CS final so that there's consistency and calibration before all of the CS finals. Faculty grading and calibration is then reviewed by the department chair. So we can go to great pains to try to make sure that there is as much consistency as possible across the curriculum. But aware, if you do have concerns about your grades, and we are all human, there have been mistakes, they are rare, but when they happen, bring them to your facilitator first. If you don't get resolution there, feel free to email me as the course director. I'm happy to look into these issues. If you do have questions and those questions are answered in the course syllabus, I'm going to ask you to go back and read the materials that you should have read from the course syllabus. 80% of the questions I get come right out of the course syllabus. Read the course documents. Now, if you have questions beyond that, I'm happy to answer them. Remediation. For those circumstances where students will pass the semester but fail the CS final, because again, 70% of your grade comes out of your activities, and if you show up and participate for all of the activities, you can get a 70% in the CS grade, the CS course, even before you walk into the final exam. So you can technically fail the final and still pass the semester because you've done everything else that's been required. But in those situations where you do fail the final exam, you will be asked to remediate. And this adds a whole nother level of work into your next semester or the time frame between semesters. You really don't want to have to do this if you can just put the time in throughout the semester and gain these skills prior to the final. Remediation is only for those students who fail the practical exam yet still pass the course. The rationale behind this is you need to be able to perform a minimum level of proficiency in order to do all the activities from semester 3 on. So if you don't know how to do your PE skills exam, then you're not going to be prepared for the next semester anyway. So you need to remediate even if you've passed the semester. Remediation may occur during the break before classes start the following semester. On the weekends of that semester, it pays to pass the practical the first time through. Attendance. Let's talk a little bit about this because we've already talked about this some, but I want to emphasize this, that you can only get an excused absent by either a health note or through student affairs. Those are the only two avenues to get an excused absence. Any unexcused absence is going to result in a 0 for whatever the assignment is that you missed. If you miss an assignment that is a mandatory assignment or an assignment that has a professional patient, that gives you a 0 for that assignment and up to 25% reduction in your entire semester CS grade. Let me say that again. You miss an assignment that has a standardized patient, you can miss up to 25% of the entire semester grade. That puts you at risk for failing the semester for being late or not showing up for one class. It is an issue of professionalism. We take it very seriously. Don't let this happen. It happens every semester. You're warned on the front end, and you'll be warned when it happens. This is a serious issue. And let me just give you the mindset that if you show up 30 seconds late for a woman who's delivering her child, she's not going to care what your excuse is. She had to deliver that baby on her own. You will be hearing from her attorney. We want to inculcate in you the idea, the mindset, you must be on time. This is your one responsibility. And in the very near future, we will be entrusting patients' lives into your hands. We need to know that you can be where you need to be and when you need to be there. That's why we take these issues that seriously. So the consequences behind missing an assignment or being late for one of these assignments is dire. So you live in an area where there will be traffic on I-40. You need to budget time in your schedule so that the unexpected happens, it doesn't cause consequences to you. We are not going to be interested in what the excuse is. You need to be aware there will be consequences. Make sure you don't have those issues fall into where you're going to face dire consequences because you didn't give yourself some wiggle room on your schedule. Dress code. During the PE skills, again, each of the PE skills on the course documents is going to give you details as to what the dress code is. For any of the PE skills, professional dress is fine. For the Neuro 1, Neuro 2, and Neuro 3, blue scrubs is adequate. For SGL, IST, with each of the sessions for SGL, there will be a standardized patient present, so professional dress is required at every one of those sessions. For men and women, professional dress is going to be open to some interpretation. If you question whether something looks modest or whether your hair is appropriate, err on the side of caution. Again, you are not trying to meet the idea of your colleagues as to what modest is. You're trying to meet the idea of your patients as to what modest is. So if you've got the 65-year-old church lady as a patient, what do you think she would see as modest? That's what your mindset needs to be. You are trying to be what your patients need of you, not what your colleagues think is modest. For simulation, dress code for Harvey, blue scrubs is adequate. With your white coat, professional dress is okay if you'd prefer. For the text for the CS course, Bates Guide to Physical Exam and History Taking, the 12th edition, is your text. There will also be Fundamentals of Healthcare Improvement, which will be posted on Canvas for you. That's a supplemental text that will be part of your SGL assignments. Your schedules. Again, get into the professional habit of checking your email and checking your schedule every day. Changes do occur. Medical school is a very dynamic process. There are constant changes being made. Your professors will change slides in their PowerPoints. So review the documents on a daily basis. Make sure you're checking your emails daily, checking your schedules daily. You cannot give an excuse that I did not see it on my email and I checked a week ago. That is not going to fly. And asking an upperclassman what you should do and when you should be there is not going to fly. You are responsible for checking your schedule every day and checking your email on a daily basis. So we wish you the best of luck. We are here as resources to help. I'm happy to answer any questions you might have. Let me emphasize that. I'm here as a resource. If you have any questions, feel free to email me. But make sure you read the course documents. If you are asking me questions that are already explained in your course documents, I'm going to know you didn't read your assignments, and then I'm going to suggest that you do so. But I'm here to help in any way that I can. Again, my email is markkimpton@rossu.edu, and we wish you the best for this semester.